Welcome to A Brief Timeline of Autism with Dr. Jess. I'm a licensed clinical psychologist who works in pediatric psychology. I also did my postdoctoral fellowship in developmental pediatrics with a focus on autism and other neurodevelopmental assessments. So to kick us off, let's go back to 1943. And this is when Leo Kanner, an Austrian-American psychiatrist and physician, first described autism when he wrote about children with, quote, extreme autistic aloneness, delayed echolalia, and a, quote, anxiously obsessive desire for the maintenance of sameness. Then, in 1968, the DSM-2 came out, and autism was defined as a form of childhood schizophrenia marked by a detachment from reality. Then, in 1980, the DSM-3 came out, and in this, autism was defined as a pervasive developmental disorder characterized by lack of interest in people, severe impairments in communication, and bizarre responses to the environment. Additionally, all of these things had to have an onset before 30 months of age. In 1987, the DSM-3 revised version, so the DSM-3R, came out, and autism was revised by adding a diagnosis at the mild end of the spectrum, known as pervasive developmental disorder not otherwise specified, otherwise known as PDD-NOS. Additionally, the 30-month onset requirement from the DSM-3 was dropped. In 1994, the DSM-4 came out, and this is where autism was first defined as a spectrum through 5 conditions with distinct features. So we had autism and pervasive developmental disorder not otherwise specified, as we had in the DSM-3R. Additionally, they added Asperger's disorder, childhood disintegrative disorder, which is characterized by severe developmental reversals and regressions, as well as Rett syndrome, which affects movement and communication, primarily in girls. Then, in 2013, the DSM-5 came out, and this is where autism became autism spectrum disorder. And this is characterized by 2 groups of distinct features. So the first group is persistent impairment in reciprocal social communication and social interaction, and the second group is restricted interests and repetitive patterns of behavior. The DSM-5 eliminated Asperger's disorder, PDD-NOS, and classic autism, but added social communication disorder to include children with only language and social impairments. Additionally, childhood disintegrative disorder and Rett syndrome were removed from the autism category. So as you can see, the definition of autism has changed and expanded over time. And this expansion of criteria is just one of the many reasons that we have seen an increase in autism diagnoses over time.